policy. This is nothing but a win for conservatives.
Well, okay, so let's get to the tax policy. So as I understand it, and I'm just reading this, so I may have it wrong, but there's an investment tax in here, the net investment income tax. And as far as I know, it only kicks in on couples making over $250,000 a year. So it's a tax on wealthy investors, and you're eliminating it. In a health
3.8% tax. Yeah,
that's exactly right. So I guess my question is, looking at the last election, was the message of that election really, we need to help investors? I mean, the Dow is over 20,000. Are they really the group that needs the help?
This was a tax on capital income, which is bad for economic growth. It's basically a capital gains tax increase, effectively, to finance Obamacare. We're undoing Obamacare, so we're not going to keep Obamacare taxes in place. So all of these taxes, $1 trillion tax cut that this bill represents, that is part of that $1 trillion tax increase that was in Obamacare to finance Obamacare.
No, I know, but
we're repealing. No, but we promised we would repeal the Obamacare taxes. This is one of the Obamacare taxes, so we're keeping our promise. And by the way, it's bad tax policy because it's bad for economic growth, and we're also repealing the Obamacare spending. So we're getting rid of its taxing, and we're getting rid of its spending, and this is us keeping our word. You may want to keep that 3.8% tax. We're not going to keep it because it was part of Obamacare.
Well, but lots of things are part of Obamacare that you just said a minute ago you're not doing anything about because you can't under
only
reconciliation.
Because of reconciliation.
You don't have to meet, that's right, but you just said that you don't have to meet every promise in this first round.
That's
and
right.
Yet, I guess it's a macro
fiscal
question.
policy we can be, but tax and spending policy we can, so that's what we're doing.
But also, I mean, you have the overview here is that all the wealth basically in the last 10 years is stuck to the top end. That's one of the reasons we've had all this political turmoil, as you know. And so kind of a hard sell to say, yeah, we're going to repeal Obamacare, but we're going to send more money to the people who've already gotten the richest over the last 10 years. I mean, that's what this does, no? I'm not a leftist. It's just that's true.
I'm not that concerned about it because we said we were going to repeal all the Obamacare taxes. This is one of the Obamacare taxes. The other point I'd say is this dramatically helps us toward tax reform. I know it gets a little wonky, but by getting rid of the Obamacare taxes, the next bill coming up this spring and summer is tax reform. And that means the new tax code that we're proposing, we put this in our Better Way plan too. It's a part of our blueprint. Go online and read that as well. That will not have to overcome those Obamacare taxes, meaning when we have a new replacement tax code to gut and replace this tax code, it won't have to also replace the Obamacare taxes. So by getting rid of all these taxes, we're lowering the revenue that is taken out of the American economy, out of families, out of businesses for the government, and we think that's really important.
So tell me, the individual mandate was the thing that most people dislike the most, I think, about Obamacare. And I just want to make sure I understand this. So that's gone, but there's going to be a cost for late enrollment, and it's going to be, if I'm reading this right, 30% surcharge on the annual premium. So if a plan costs, say, $5,000 a year, that means you have to pay just an extra $1,500 a year to pay the penalty.
Yeah, so let me explain why that is.
So why wouldn't I just wait till I get sick to buy insurance?
No,
how is that going to work?
That's the point. That's why we're tightening the enrollment period. We're having continuous coverage, and that's why Tom Price already put out a regulation saying we're not going to have an open enrollment period for a year. One of the reasons why Obamacare is collapsing and it's crashing and its prices are so high is because they had an open enrollment plan time for a year, which is exactly what you're saying is what is happening now. What we're trying to do is prevent that from happening so we can drop the price of health insurance. You can't just say to somebody, wait until you get sick, then buy the health care. If you do that, then the health care gets really expensive. That's what's happening now. This tightens that up so that we can drop the cost of health care. But gives people a do-over. Gives it, look, if you want to go from this plan to the next plan, by the way, in the employer market, they already have these rights. So what we're basically trying to do here, Tucker, is equalize the treatment and the fairness between people who get health care from jobs and people who don't. People who get health care from their work, they can move from plan to plan without any penalty. We want to just give people in the individual market, guys working $10, $15 an hour jobs that don't get health care at it, we want them to be able to be successful. We want them to be able to have the same kind of tax treatment everybody else gets so that they can get affordable care. This does that. So
what are you going to do about emergency Medicaid, which is a huge cost for the states? Billions a year are spent. It's 100% goes to illegal aliens, as you know. Journal of the American Medical Association, 99% of this money goes to illegals, mostly to bear children at public expense in U.S. hospitals. And again, it's a big problem. Why isn't that defunded in this?
Well, again, we're looking at bird rule reconciliation issues. What we're trying to do is make sure that you
couldn't defund it under reconciliation?
Yeah, we've got a little issue with that, and we're working on that with the Senate. So, again, we've got these goofy Senate rules we've got to work with. We can't do every single thing we want to. We would do all of these things if we could without getting a filibuster, but we don't want to jeopardize this bill and make it subject to a filibuster, which means we can't do anything. So that's why we're trying to do this, so that we conform to the Senate rules. But here's one more point I'd say. Because we're delegating, we're giving Medicaid back to the states. It's
Right.
a massive amount of federalism. Then the border state governors can do that. The border state governors decide what happens with their Medicaid populations. We cap it, we stop the expansion, we grow it at a slower rate over time, which saves trillions in the out years, which is a massive amount of debt reduction. And that is what we're doing here, which is a huge, huge conservative step forward for entitlement reform as well.